Getty Images Heather Saul 7 hours Thursday, September 21, 2017. A leading cosmetic clinic has expressed concern over the way some clinics and surgeons are using images to promote cosmetic procedures on social media. The Cadogan Clinic, a private clinic in Chelsea, West London, is calling for more awareness of the impact of social media on self-image and the quest for body perfection, saying many young people are coming in with unrealistic images of eye shapes and contours and asking to look like them. Surgeons at the clinic also highlighted concerns over social media accounts of clinics sharing sad images on pictures of pre-op patients and then happy images on post-surgery images. I found images on 4 accounts belonging to cosmetic clinic groups and surgeons which showed sad faces over nipples before operations and happy faces over post-op nipples. Desperately needs regulation. These are images I found on social media accounts of surgeons or clinics. The clinic said this form of promotion on platforms like Instagram is irresponsible in that it can suggest people look better after a procedure, adding this is an area of the cosmetic surgery, an industry worth an estimated £3.6 billion, which desperately needs industry regulation. Women's nipples have to be covered up on Instagram to comply with its community rules about nudity. Some clinics use flowers, hearts or colored circles to comply with this standard. The Advertising Standards Authority (ASA) does not prohibit the use of images. However, it requires clinics to be responsible in their advertising on social media, particularly if it is likely to appeal to young people. A spokesperson told our advertising rules and guidance reflect the fact that cosmetic surgery is a serious procedure that can have a physical and, sometimes, psychological impact on a patient. It must be socially responsible, including those appearing in social media, and must not trivialize the decision to undergo surgery. While the use of images in cosmetic surgery ads is not, in and of itself, prohibited, the protection of young and potentially vulnerable people is at the heart of our rules, and we take seriously any concerns around potentially irresponsible or harmful ads for this procedure. The ASA said it cannot comment on specific examples when asked if images used in this way could potentially be irresponsible. One surgeon who does use happy and sad images on their before and after photos told I the images on my Instagram feed are to protect modesty and to comply with Instagram's rules about not showing nipples. I use a variety of images to reflect in a lighthearted way the patient's unhappiness with their current breast shape. The very reason people have come to see me in the first place is because they are unhappy about their breast shape or volume. The happy images reflect a patient who is delighted with the result and whose self-esteem is restored. More young people asking for fillers. Botox. Getty Images. Drive. Anjali Mato, a consultant dermatologist at the clinic, told she has seen a rise in young patients seeking unnecessary treatments such as injectable Botox and lip and face fillers. I am frequently finding that I am questioning patients more when they are in their 20s and wanting injectables, she said. Sometimes I feel they trying to combat self-esteem issues that no amount of lip filler will solve. Others simply will not get a good aesthetic result as it will ruin the natural beauty or harmony of their face, and some are not at the stage in their life where they need treatment or enhancement. Dr. Mariam Zamani, a consultant oculoplastic surgeon and aesthetic doctor, said she has noticed an increase in patients seeking cosmetic procedures with the hope of looking like someone else, often bringing photos or videos from social media to consultations. Clinics must be realistic with patients' overall outcome. Dr. Zamani said clinics should perform stringent reviews of a person's medical history and ask directly about any mental health issues they may have. It is vital to access information on past medical procedures, both surgical and non-surgical, and also to garner an understanding of other emotional impacts that are influencing their decisions such as death, loss of job, the end of a relationship and bullying. Any of these indicators can signify a red flag, and it is important to help the patient find appropriate care to improve self-esteem and body confidence. Only when they are in a good mental state should they embark on tweaks. The Cadogan Clinic called on the industry to put a greater focus on the suitability of individuals for the procedures they request. This involves taking the time to counter unrealistic expectations and declining to treat patients who are too young, have already had too many procedures, or where the procedure can be a risk to their health. news.co.uk